Did you know that lung cancer is one of the most common types of cancers worldwide, and it mostly does not show symptoms until it's advanced? It's important to recognize the early signs that indicate a problem. So, let's learn about the top 10 signs of lung cancer that you should never ignore. Number 1. Unexpected shoulder or arm pain. One of the major signs of lung cancer is shoulder or arm pain, especially if it is continuous and is not linked to an injury. Shoulder or arm pain in lung cancer is usually related to a specific type of tumor, known as a Pancoast tumor. These tumors are located at the very top of the lung, near the apex, and affect the nerves leading to the upper limbs. They are quite rare and have distinct symptoms due to their unique position. And the reason behind it is that the top part of the lung is close to a network of nerves called the brachial plexus. Pancoast tumors grow into these nerves, leading to pain and discomfort. The pain might feel like a deep, aching soreness, or it can be sharp and shooting. As the tumor affects the nerves, it also causes sensations like numbness, tingling, or even weakness in the shoulder, arm, or hand. These sensations are due to the disturbance in normal nerve signals. At the start, the pain is usually mild and irregular, but as the tumor grows, the pain becomes constant and more severe. Sometimes it also worsens with certain movements or at night, interfering with sleep. Number 2. Changes in the appearance of fingernails. Have you ever noticed your fingernails looking a bit different? Yeah, it might also be a symptom of lung cancer. The appearance of the fingernails changes in lung cancer, especially in a condition known as clubbing. Clubbing means changes in the areas under and around the fingernails and indicates hidden health issues. Clubbing usually occurs because of lower oxygen levels in the blood, which is a common issue in lung cancer, as the disease prevents the lungs from efficiently absorbing oxygen. When oxygen levels drop, it triggers changes in the vessels that supply blood to the fingers, leading to clubbing. In response to reduced oxygen levels, the tissues at the fingertip and nail bed swell and change. The nail and fingertip start to bulge outward. The nail itself becomes more curved, resembling the spoon shape, and the nail bed softens. This results in the distinctive downward curving of the nail. The process behind clubbing also involves changes in the vascular system, which is the arrangement of blood vessels in the body. It is because substances released by tumor cells, such as hormones or growth factors, encourage the small blood vessels in the nail beds to expand or widen, resulting in the clubbed appearance. Number 3. Difficulty swallowing. Facing difficulty in swallowing or a feeling of food being stuck in your throat is more serious than being uncomfortable. It is also a sign of lung cancer. In lung cancer, difficulty swallowing occurs if a tumor develops near the esophagus, which is the tube that food travels through to reach the stomach. If the tumor is in the upper part of the lungs or has spread to nearby lymph nodes, it exerts pressure on the esophagus, narrowing it. This narrowing makes it harder for food and liquids to pass through, making food feel stuck in the throat or chest. The lung and the esophagus share some nerve pathways that are affected if a tumor attacks them. The vagus nerve, which plays a role in swallowing, is especially affected. If this nerve's function is compromised, it affects the rhythmic contractions that normally help push food down the esophagus. Difficulty swallowing is not just a physical issue, it significantly affects your emotional and social life too. Imagine sitting down to a meal, a time meant for enjoying food and the company of others, but instead, you feel anxious and uncomfortable because swallowing is difficult. It feels like missing out on a simple daily pleasure. Number 4. Eye problems. Did you know lung cancer also leads to eye issues? You may find it unrelated at first, but it is an indicator of many diseases, including lung cancer. A classic example of lung cancer affecting the eye is Horner's syndrome. This occurs when a Pancoast tumor disturbs the sympathetic nerves. People with Horner's syndrome sometimes experience slight drooping of the eyelid on the affected side, giving them a tired appearance. Also, the pupil on the affected side becomes constricted, making it look noticeably smaller than the other. Another symptom is a lack of sweating on the affected side of the face, which is subtle but distinctive upon closer examination. Besides, Some people also face changes in vision if the tumor pressures the optic nerve indirectly or disturbs the blood flow important for eye health. These subtle changes, such as slight blurriness or difficulty focusing, are mostly overlooked until more severe symptoms appear. Thinking about how. Let's get into this. One key factor in how pancoast tumors affect the eyes is their impact on the sympathetic nerve chain, which runs along the neck and up to the face. This chain includes the cervical sympathetic nerves, which control parts of the eye and eyelid. If a tumor presses on or attacks these nerves, it disrupts normal nerve function, leading to several eye problems. Number 5. Persistent or recurrent infections. Continuous or recurrent infections, especially in the respiratory system, are frustrating. When they occur in lung cancer patients, there is a deeper connection that explains why these infections keep coming back. Understanding this link is beneficial for maintaining a better quality of life. Let's get into it. One key reason for recurrent infections like pneumonia or bronchitis is hurdles within the airways. When a tumor grows in or near the airways, it partially blocks them. This blockage affects normal airflow and traps bacteria, viruses, or other pathogens in the lungs. The stagnation of air and pathogen buildup makes the lungs a breeding ground for infection, which recurs if the blockage remains untreated. Lung cancer also compromises the lung's ability to clear out pathogens and debris. The lungs have built-in processes, including cilia, which are tiny hair-like structures. They help eradicate contaminants and excess mucus. If a tumor affects these areas, the efficiency of these natural cleaning processes decreases, leading to a higher sensitivity to infections. This is especially problematic in lung cancer, as the disease damages lung tissue and affects normal lung function. Number 6. Swelling in neck and face. Swelling in the neck and face is more related to allergies or other conditions, but it is also an alarming sign of lung cancer. Understanding why this swelling occurs is important for proper treatment. This condition is known as superior vena cava syndrome. If you don't know, the superior vena cava is a large vein that carries blood from the head, neck, upper chest, and arms back to the heart. When lung cancer leads to tumor development in the upper right part of the chest, it presses against this vein, hindering blood flow. This blockage prevents blood from draining effectively from the head and upper body, leading to swelling in these areas. Also, lung cancer spreads to lymph nodes in the chest and neck area. Confused about lymph nodes? Lymph nodes are actually small glands that are part of the immune system. They help filter out harmful substances from the body. When cancer cells block or reduce the flow through these lymph nodes, they build up the lymphatic fluid, leading to noticeable swelling. This is true for the lymph nodes located above the collarbone and in the neck, which when enlarged cause swelling in the face and neck. Number 7. Unexplained weight changes. Unexplained weight fluctuations, whether losing or gaining weight without changes to your diet or exercise habits, are also an indicator of lung cancer. Cancer cells require a lot of energy to grow and multiply. As lung cancer develops, it increases the body's overall metabolic rate, which means it burns calories at a faster rate than normal. Even without changing your diet or exercise habits, this increased metabolic demand leads to significant weight loss. Also, the presence of cancer in the body triggers systemic inflammation, which alters metabolism and muscle composition. Inflammatory molecules lead to muscle wasting. It is a condition where the body loses fat and muscle speedily, contributing further to weight loss. Sometimes, lung tumors act a bit out of the ordinary and release hormones they should not, like ACTH. This hormone triggers the production of cortisol. This excess cortisol causes a condition called Cushing's syndrome. It's like the body's stress levels are too high, resulting in weight gain, especially around the belly and face. You will also notice other signs like bruises that appear too easily and purple stretch marks. So, it is important not to take your body weight fluctuations lightly and consult your doctor if you notice unusual changes. Number 8. Severe fatigue. We all feel tired from time to time. It's mostly because of a lack of rest or excess workload. Sometimes we don't get enough sleep and feel drained. But the excessiveness of this feeling is something serious. It could be an indication of serious health issues like cancer. Fatigue associated with cancer is not about feeling sleepy. It's different from normal fatigue. You feel a pervasive sense of exhaustion that does not improve with rest. This is due to the cancer taxing the body's energy resources or due to anemia, another common side effect of lung cancer. Anemia is a common condition in lung cancer patients where there's a decrease in red blood cells, the cells responsible for carrying oxygen throughout the body. Tumors cause anemia by bleeding or by interfering with the body's ability to produce enough healthy blood cells. Lower hemoglobin levels mean less oxygen is transported to tissues and organs, resulting in fatigue. Besides, as you know, cancer cells are notorious for their high energy demands. As they grow and multiply, they consume a significant amount of the body's resources, which depletes energy levels. This increased metabolic rate means the body has to work harder to maintain basic functions, leading to a continuous feeling of fatigue. Number 9. Worsening bone pain. Worsening bone pain is another symptom of lung cancer. It significantly affects one's quality of life, making everyday activities challenging and sometimes unbearable. This type of pain indicates that the cancer has spread beyond the lungs to the bones, a process known as metastasis. Let's get into its details. Lung cancer cells break away from the primary lung tumor and travel through the bloodstream or lymphatic system to other body parts. The bones are a common site for these cancer cells to settle and form new tumors. Bone metastases affect the normal balance of bone breakdown and rebuilding, weakening bones that are more sensitive to pain and fractures. Also, cancer cells in the bone produce substances that activate osteoclasts. These are the cells responsible for bone resorption. This increased activity leads to excessive bone breakdown. As the bone structure deteriorates, it causes severe pain, especially in weight-bearing bones like the spine, hips, and legs. Number 10. Hoarseness or changes in voice. Last but not least is hoarseness or changes in voice. Although hoarseness or voice changes do not immediately indicate lung cancer, they are important symptoms of lung cancer. Hoarseness refers to any change in voice that makes it sound breathy, raspy, or weaker than usual. Your voice starts tiring easily, or you cannot maintain a consistent vocal pitch. These changes are frustrating because they affect how you communicate with others, impacting social interactions and personal relationships. One big reason for hoarseness in lung cancer is because of a nerve called the recurrent laryngeal nerve. This nerve is like a pathway that helps control the muscles in your voice box. It runs near the lungs and lymph nodes in the chest. In lung cancer, especially tumors in the upper left lung or when cancer spreads to nearby lymph nodes, these tumors press on this nerve. When that happens, it is tough to talk clearly because the nerve can't work properly. Lung cancer is stealthy, but being informed about all possible signs, not just the common ones, empowers you to seek help early. If you enjoyed this video, please give it a thumbs up and share it with your friends. Also, subscribe to our channel to see more videos. Until then, keep yourself healthy.